Over the past few months, the United States has dramatically changed the official childhood vaccine schedule, something that affects millions of families, public health professionals, and communities. These changes are not minor tweaks. They reshape what vaccines are recommended routinely for all children and how families and doctors make decisions about immunizations. And that's the topic of this week's Healthcare Triage. In the long-standing U.S. federal vaccine schedule, there used to be routine recommendations for vaccines protecting against 17 different diseases. But the new policy issued by the Department of Health and Human Services reduces that list to 11. That doesn't mean vaccines disappear entirely, but it does mean several that were once recommended for all children are no longer placed in that category. So what's actually changed? For many parents, the most visible shift is that vaccines for flu, COVID-19, rotavirus, hepatitis A, hepatitis B, and meningococcal meningitis are no longer listed as routine for every child. Instead, they've been moved into categories that require more individualized conversations between a parent and healthcare provider. This is often referred to as shared decision-making, and while that's an opportunity for personalized care, it works best when there's clear communication and reliable information available to everyone, which we know isn't always the case. Under the new federal approach, vaccines that remain recommended for all kids include those that protect against diseases like chickenpox, measles, mumps, rubella, polio, whooping cough, and HPV, among others. The reasons given for the overhaul include aligning U.S. schedule more closely with what some other developed countries do and giving families more room for individualized decision-making. But this shift has sparked heavy discussion and confusion among parents, healthcare professionals, and public health experts. One major point of concern is that removing the broad, universal recommendation could change how doctors talk about vaccines and how families think about them. Some experts worry that shifting recommendations away from routine can lead to lower vaccination uptake, especially if families don't have strong guidance or easy access to healthcare providers. Saying, "Talk with your doctor about this," may unintentionally become a barrier for some families, especially those with limited access to medical care or time to navigate nuanced decisions. That issue may be further compounded by current splits in professional guidance. The American Academy of Pediatrics, one of the leading voices in child health, has publicly stated that it continues to recommend all the vaccines that were on the previous schedule as routine for children. That means pediatricians may be recommending different things than what the federal schedule formally says, adding another layer of complexity for parents trying to understand what's best for their kids. Another concern is what it means for disease prevention. Over decades, routine childhood vaccinations have prevented millions of illnesses, hospitalizations, and deaths. The Centers for Disease Control and Prevention previously estimated that routine childhood vaccines in the United States prevented over 508 million lifetime cases of disease and over 1 million deaths among children born between 1994 and 2023. Some of the vaccines now moved into the shared decision category were responsible for preventing serious diseases like rotavirus, which once caused tens of thousands of hospitalizations each year, and hepatitis B, a virus that can lead to chronic liver disease or cancer later in life. And yet another wrinkle is how these new federal guidelines relate to state policies. In the United States, each state ultimately decides requirements for school entry, and many states use the federal schedule as the basis for those requirements. If a vaccine is no longer universally recommended at the federal level, it's possible some states could drop it from their school requirement lists, which could further influence how many children get vaccinated. This change in the vaccine schedule matters for overall public health, not in small part because public health recommendations influence perceptions and practices. It's important to stress that the science behind vaccination has not changed. The diseases vaccines protect against are real, and the data behind their benefits remains robust. Hey, you enjoyed this episode? You might enjoy this previous episode on Maha and the measles resurgence. We'd really appreciate it if you'd like the video, subscribe to the channel down below, maybe go on over to patreon.com/healthcaretriage where you can help support the show, make it bigger and better. We'd especially like to thank our research associates, Joshua Crow, Edward Loyaholm, and Christopher Learn, and of course, our Surgeon Admiral, Sam.